Welcome to this PowerPoint presentation. This is the medical terminology class, and the title of my presentation is What is Progressive Supranuclear Palsy or the Steele-Richardson-Olszewski syndrome? PSP is the most common abbreviation that the doctor use when they talk about progressive supranuclear palsy. So let's start with the presentation. Definition. What's PSP? It's an uncommon brain disorder that causes serious problems with walking, balance, and eye movement, and later with swallowing. The disorder results from deterioration of cells in areas of your brain that control body movement, coordination, thinking, and other important functions. The symptoms. Often the first sign is a problem with balance while walking. The person may fall backward a lot, or the person feels rigid, uncomfortable when walking. Changes in behavior such as lack of interest, muscle stiffness, an inability to control eye and eyelid movement, including focus on specific objects or looking up or down at something. Slow, quiet, or slurred speech, difficulty swallowing or dysphagia, and slowness of thoughts, and some memory problems. Types of PSP. About half of everyone with PSP has the Richardson syndrome. This is the most common first symptom, which occurs on average when a person is in her 60s, is loss of balance while walking. The second most common form of PSP is called PSP Parkinsonianism. Its early stage more closely resemble those of Parkinson's disease, with less emphasis on balance problems and behavior changes, and more on tremor. These typically have a better early response to anti-Parkinsonian drugs than is typical for PSP. PSP Parkinsonism comprise about a quarter of all PSP. PSP is diagnosed based on clinical signs and exams findings like MRI, but often is not easy to diagnose. There is no single test that points right at it certainly. It is often mistaken for Parkinson's disease, and it can sometimes take years to distinguish PSP from PD. Treatment. As PSP can affect many different areas of your health, you will be cared for by a team of health and social care professionals working together. For example, a neurologist, a physiotherapist, a speech and language therapist, an occupational therapist, a social worker, an ophthalmologist, an orthoptist, a specialist neurologist, nurse. Medication. There are currently no medication that treat PSP specifically, but some people in the early stage of the condition may benefit from taking levodopa, emantadine, or other medication used to treat Parkinson's disease. How is PSP different from Parkinson's disease? This is very important because the doctor sometimes confuse a patient with PSP with a patient with Parkinson's disease. So both PSP and Parkinson's disease cause stiffness, moving difficulties, and clumsiness, but PSP is more rapidly progressive as compared to Parkinson's disease. People with PSP usually stand exceptionally straight or occasionally even tilt their heads backwards. This is termed as axial rigidity. Those with Parkinson's disease usually bend forward. Problems with speech and swallowing are much more common and severe in PSP than in Parkinson's disease, and tend to show up early in the course of the disease. Eye movement are abnormal in PSP but close to normal in Parkinson's disease. Both diseases share other features onset in late middle age, like brachinesia or slow movement, and rigidity of muscles. Tremor, very common in individuals with Parkinson's disease, is rare in PSP, although individuals with Parkinson's disease markedly benefit from the drug levodopa. People with PSP respond minimally and only briefly to this drug. Also, people with PSP show accumulation of the protein tau, TAU, in affected brain cells, while people with Parkinson's disease show accumulation of a different protein called alpha-synuclein. Finally, this is a good summary. It's like an infographic. It's a summary of what is PSP and the different symptoms. So, thank you for your attention.